Have you ever wondered why no one really talks about feeding posture, even though it is something our dogs do every single day? We hadn't either until we couldn't ignore it. You are not alone, and that is exactly what we are diving into on today's Tails and Tones. Alrighty, let's dig in. Hi there, welcome to Tails and Tones. I'm your host, Mariska Nell, also known as Piper's mom. And today we are going to talk about all the small everyday choices that quietly shapes our dogs' lives over time. And today's episode started with a very real wait. Why do not everyone talk about this moment? But before we go in any further, I also want to really clarify something. So this episode is not about saying that elevated bowls are honestly the best thing or that every dog should use one, because they should not. Not every dog should use an elevated bowl. It is not a blanket advice that is meant, for all dogs, just like, dogs themselves. Everybody is different. So there is a huge range of, size, structure, posture, physiology, and even anything from like a tiny toy breed to a large, deep, crested dogs. And their feeding advice really needs to reflect that. For some dogs, an elevated or posture-adjusted feeding setup can be, honestly, one of the most supportive ways that you can actually help them. For other dogs, particularly certain like large or deep-crested breeds, feeding from an elevated bowl may actually cause more harm than good. And we are going to walk you through that nuance together, including which dogs tend to actually benefit and which dogs don't. And I also want to say that I am not a vet, and but what I've done here is basically taken a very close look into some of the veterinary literature and studies that was available. I also, had very long and hard conversations with a number of vets, with canine or animal physios, and got a lot of guidance from them, and really connected that with also our lived experience, as well as, a lot of our pet parents that I spoke to as well. So it is a variety of information. So if, you finish this episode and you might think, I'm still not 100% sure whether my particular dog, needs this. Where do we kind of fit in? I would really encourage you to have that conversation with your vet or your canine physio. And before, we had all of this with Piper, we didn't even know canine physio existed. So they are there and they are ready to assist. And so this episode is really more about understanding the why, not really telling you should do this or shouldn't do this. Alrighty. With that context in place, let's hit the ground running. So we didn't actually realize how important the posture was until Piper had a visit to our vet where, she really could see, oh my goodness, Piper's got some shoulder and neck stiffness. And it was really to a point where she didn't really, want anyone to touch it. And it was only when we really exposed it. And we had genuinely no idea. It was the first time that, even anyone actually mentioned that this could happen to dogs. And, for us, that meant Piper was starting physio. And, we could definitely see the difference it made, in her playfulness. And honestly, it is just so notable but there was a couple of things that led up to that as well. But for sure, like being more comfortable. And I mean, it is like when you go to the physio or the chiro, or, if you go for a massage after you've got some back pain, you just feel so much better afterwards. So I assume that's exactly how Piper must have felt. And as we actually talked with our physio through Piper's like routine, so like her walks, her harness, her stairs that she used on the sofa, how she sleeps, like her bed, and overall her movement, she asked me something I honestly wasn't expecting. And that was when she said, "What does Piper's feeding setup look like?" And I remembered thinking, wait, what, the bowl? And she asks specifically whether Piper eats and drinks from an elevated setup. So we have always had Piper's water on like an elevated like setup. So she's got an elevated bowl, but not her food. And honestly, that just haven't crossed my mind. And that was the moment kind of when the penny dropped, that everything clicked. And that feeding posture isn't just like neutral, it's like a movement pattern. It is something that is repeated every single day. And some dogs get fed twice a day, some once, some three. And it is really, really an interesting thing to actually look at. And once you see that, you honestly can't unsee it. And an elevated food and water setup was actually one of the first things that the physio said that she would recommend to so many of her patients. And so why does this matter? Why does it matter for us to actually provide them with this? So, when we have dogs and we place their food basically flat on the floor, it often requires like a lot of like neck flexion. And I mean, you wouldn't eat your food like this. It's really a forward shift of weight. And especially with some smaller dogs, when you look at their head versus body ratio, their head is quite a large portion, and it's also quite a heavy, like skeletal side as well. So it is a lot of weight that kind of have to shift every time they take a bite. And really increase the load, they through their shoulders as well. So their shoulders and their neck definitely wears a lot of tension. And so a lot of vets and physio guidance generally agrees that, repeated down posture can increase the strain on it. So there's a lot of different stuff if your dog plays those like tug of war games, and there's many that, can also contribute to this. But this is a daily thing that we can really, control as well. And when it kind of puts strain on their spine, so it can really increase the strain on their spine, their shoulders, and also their joints. So for some special like dogs, like brachycephalic dogs, so your Frenchies, your Pugs, your Bostons, for them, they are very prone to all of these issues in any case. So you definitely want to make sure we don't add extra on there as well. So brachycephalic dogs, we've got senior dogs. For a lot of senior dogs, this becomes vital as they age, because anything we can help them with can really, help or improve their lives. So also dogs that has arthritis. And like a lot of dogs actually develop arthritis if they've got like a broken bone, or, like with Piper, she's got a very high chance of developing arthritis because she had a luxating patella repair as well. But also a lot of dogs that is prone to get IVDD or has IVDD, for them elevated bowls totally makes sense. And also if you've got some mobility limitations, so that can really help them. And so one of the clinical studies I read, they actually said that dogs weren't really designed to literally crane their necks down to the floor multiple times. especially as they age. I mean, when they're smaller, they're littler, it's a lot easier, but as they grow, it can become very uncomfortable. So one awkward movement doesn't really matter much, but if we put that strain repeatedly every single day, multiple times, then that absolutely does. Now, so for me, it was honestly heartbreaking to just think that Piper might have been dealing with a lot of discomfort. And, I couldn't help but really compare that back pain to my back pain. Where, at some point, if I've got such bad back pain, I would almost want to stay in bed all day. You book a session with your chiro, you go to the physio, or you even get that massage to just release the tension. So why would it be different for dogs? And that just really broke my heart. So now that I know, I want to be able to do better as well for Pipes. And there's another subtle sign that the physio pointed out I felt it was really helpful. I didn't know that beforehand. And sometimes you'll realize, you'll see little folds, especially with the Frenchies, the Pugs, those type of dogs where they've got almost these neck folds. Now, for some, that might be a little bit of an extra weight that's being carried around, but if your dog is really at a healthy weight range, those neck rolls can sometimes be a sign of an underlying stiffness or reduced mobility through the neck and the shoulders. So it's definitely something to, look at. This is not a diagnosis, and it should also not send you in panic. But if your dog does have that, try and see, maybe there's some massage techniques you can try at home, or when you do go to your vet the next time, maybe just ask them about that. That is just one more thing to kind of notice, especially if it shows up alongside, a reluctance to actually bend down, if they've got stiffness after they've rest, or I know a lot of dogs do their big stretches, but sometimes, how are they walking afterwards? Are they very stiffed up? Just kind of notice these things, because that can all be some signs. And also if they've got discomfort during everyday movements like the eating and things, and especially as they ages, these can increase. So often it is simply, just meaning that the body is working a little harder, and it needs to almost get used to it. But it is also important to say that treating stiffness isn't as simple as, getting an elevated bowl. It's not going to, solve. It's definitely going to help them, to not progress, especially if that is the reason that's causing it. But pain and mobility issues are really best supported with a combination of things. Your vet or your physio can maybe recommend, anything from acupuncture, laser therapy. Piper loves now the water treadmill, which she didn't in the beginning, but all of that really helps, alongside some targeted exercises as well to strengthening the core, to support the neck and everything a little bit better. So there are also many simple daily exercises that your dog can benefit to strengthen that core. And in a future episode, we will be chatting with Piper's amazing physio to walk through some of those together for you as well. Now, elevated bowls can certainly help with posture, but there are other considerations too, and this part often gets oversimplified, I think, online. So elevated feeding bowls does not universally prevent or cause bloat. So some research around GDV, which is also referred to as bloat, has focused primarily on large, deep crested breed dogs. So these are your typical Great Danes, your Weimarangas, your St. Bernards. And it really shows that there is an increased risk profile in those dogs. So this is why elevated feeding is not really recommended as a blanket change. So It may not be the best fit if your dog also like gulps up their food. If they eat super, super fast, that might not be the best option. But a bowl might also not be the best option, any bowl for that matter. So in those cases, like slowing the pace of eating is usually more important than changing the height. So sometimes we need to weigh what is more important. Is like, the neck, like the stiffness in the neck, or is it preventing bloat and things like that? So we need to like take that in mind as well. But for the right dogs, like posture adjusted feeding can really reduce the air gulping. So that's one. They can also improve like the swallowing comfort, like especially with dogs that have the little flat noses. It is really hard, a lot of stuff. So making that more comfortable can really help them. And also dogs that's prone to regurgitate. Again, brachycephalics, they are so prone to it. And this reduce like aspiration related issues, which are so common again in the brachycephalics. Piper has had aspiration pneumonia. Was that related to how she eat her food? I'm not sure. But if that can prevent it in the future, 100% I will make sure she gets the best. So it isn't a magic fix, but for some people, posture alone can make digestion feel calmer. Now, brachycephalic dogs, again, Frenchies, Pugs, Bostons, the list is on. I'll put the whole list in the show notes as well. They are not just short nose. They have very altered airway anatomy. They've got different swallowing mechanisms, and they are very much at a higher risk rate for reflux and regurgitation. And now for these dogs, breathing and digestion are very closely linked. So even small changes in like the head and neck posture can dramatically affect how comfortably or safely they actually eat. So this is where posture really matters. Now, one of the most important clarifications is that elevated bowls does not just mean as high as possible. We're not going to go a one size fits all. There's so many veterinarian guidance that often describes the ideal height for your specific dog would be bringing the entire bowl closer to their lower chest, almost like their shoulder height. And I know it's a little bit harder to determine the shoulders, but basically, shoulder height, so that when your dog can eat, it's a lot easier for them without having to crane down and without having to lift the head up. Now, the goal is really to have a neutral neck position. So when we talk about elevation, what we really mean is it is posture supportive. It is not tall, one size fits all type of thing. So we need to also take that into account. Your elevated bowl height for a little Chihuahua might be a lot different than your average Frenchie. So even within the Frenchies, there's little variance, but the majority of them are very similar in the shoulder, like kind of height. Now, canine physios don't usually start with dramatic interventions. So they are not going to say, oh, we need to do, this massive thing with your dog's shoulders. They first look at a couple of things at home, like what is your sleeping surface on? Like, is the dog just sleeping on a hard tile? Well, maybe we can add some memory foam bed, maybe the harness fit. Maybe the harness is really pushing down, aggravating a few things. Maybe the flooring in your house. Are you doing zoomies, on the tiles and slipping and falling? And then also, what is your feeding posture? So those are some of the things that you can look at to see, is this actually supporting my dog the best for, their neck and their spine. And also like the stairs. If you've got like a medium and small dog, jumping up and down the sofa really has a lot of impact. I mean, it's like you doing that box jumps, every single day, multiple times a day. Yes, you'll get good at it, but it does put impact on your body. So because feeding happens like every single day, a small strain on their neck multiplied by repetitions really shape the body over time. So if feeding isn't really neutral, it needs to be really part of this like system, and it is something that we can do to support our dogs as well. So I am not here to really tell you to, buy a specific or go out now and get something. So this episode was really more about noticing and noticing how your dog stands when they eat, noticing whether, feeding looks easy, does it look a little bit awkward, also noticing the small things we don't usually question. And for us, once we started noticing those small things with Piper, we just realized how hard it actually was to find a feeding setup that truly worked for her. Something that supported her body, something that fitted with her needs, and something that didn't feel temporary or like it didn't belong in our house, because some of those feeding options were not the prettiest. And we tried a lot of options, but none of them really felt right, because Piper really struggles to like eat out of a bowl. And even if you give her like a bowl, like a flat surface, she really struggles to pick stuff up. So she needs it almost like on a silicone type of mat that is raised to that level. And yeah, so it's been a challenge. So because we couldn't find one, we just decided, you know what? Why don't we just create one that will, tick all these boxes? And it's not just because, we wanted to create a product. We really wanted to create something that can help more pet parents. Eventually, we decided to stop looking for a solution and try to create one. Not because everyone needs it, but because some dogs really do. And because when a solution truly supports your dog, it should also feel considered, intentional, and like it actually belongs in your space. And that is the journey we are on. And whether you decide to change nothing at all, or whether this episode has actually made you think maybe feeding could be a little easier for my dog, that's enough. But if you do want to follow along as we rethink this feeding thoughtfully, gently, and dog by dog, you are always welcome here. And if you'd like to follow along our actual system that is inspired by everything we've learned with Piper, you can actually join our wait list, and I'll link it on our show notes as well. And just come say hi if this episode sparked questions, or if you agree or disagree with us on this. I would love to hear from you. And if you want us to actually dig deeper into a specific breed with their feeding setup or posture or some supportive exercises, please do let us know. We build this podcast around the conversations that you want us to have. Thank you so much for tuning in today's episode of Tails and Tones. If today's episode spoke to you, please consider leaving a review on podchaser.com or share it with a fellow pet parent who might love it too. If you've got any questions or want to come and say hi, I'm always around on Instagram at Tails and Tones, where every tail tells a story and every tone speaks from the heart. See you in the next one.